Hello, this is the weekly review, making sense of relevant topics and news. I'm Roger Alfred Yoron Modi, the producer and the host. Today we shall be looking into the recently launched research report on the impact of the COVID-19 pandemic on the implementation of the South Sudan Revitalized Peace Agreement. That is the Revitalized Agreement on the resolution of the conflict in South Sudan. And Malish John Peter of the Institute of Social Policy and Research, who conducted the study, is joining us via Zoom. Welcome to the weekly review, Malish.
Thank you for having me this morning.
Though the Revitalized Agreement was signed in September 2018, there were a lot of delays in its implementation straight away, and it was until February this year that the parties finally managed to form the presidency and executive arm of the Revitalized Transitional Government of National Unity. COVID-19 pandemic also came in and contributed further in delaying the implementation of the agreement. Starting with why this study now, tell our audience also the major findings of the report.
Thank you, Alfred. Indeed, the peace agreement, since it was signed in September of 2018, it has been making baby steps in terms of implementation and having real change in the lives of South Sudanese in terms of security, safety, and stability across the country, and also in terms of socio-economic progress for the people to really realize the dividends of peace. While we recognize the delays in the implementation when the agreement was signed in 2018, we're also mindful that by the end of last year, there has been quite significant push by regional and international partners to ensure that the revitalized transitional government of national unity is established as a way to really push forward the implementation of the agreement after a double extension of the pre-transitional period that witnessed largely unimplemented key activities in the security sector that were very critical for the transitional period. Now, with the onset of COVID, just exactly about 21 days after the formation of the presidency, dynamics changed, and indeed, for us, we thought it's really useful to have a reflection on what the citizens' thoughts are in terms of the impact of the pandemic on the peace agreement. And as such, we conducted this study to examine the public opinions and perception on the impact of COVID on the peace process, and also to look at the roles of the different actors, whether the political parties to the agreement or the regional international partners, and also the peace monitoring mechanism, how the pandemic has really affected their work, that they would have really done much better in terms of pushing forward the agreement. Yeah, there are quite interesting findings that came out from this research, but just to remind the listeners that we interviewed 510 respondents across 4 towns in Juba, Torit, Yambio, and Wau, and we selected these towns based on their cosmopolitanism, the diversity of residents in these areas, and also the uniqueness in terms of the implementation of the agreement itself. And out of these 510, 39.4% were women and 60.6 were men. So the findings that are quite clear that stand out in this research basically because we asked the respondents basically to tell us if they recognize the restrictions of COVID-19, and 73% said yes, they are aware of the restrictions that the government imposed as a result of COVID, and we also asked them if they do support some of these restrictions, and 75% said yes, they're genuine, and they support the government in that regard. And what is really quite touching is when we ask the participants to basically tell us whether COVID-19 pandemic has had an effect on the implementation agreement, and we rank this from major effect to no effect, and 44.5% said there was a major effect that the pandemic has had on the implementation of the agreement. And when we asked them to identify some of the gaps that perhaps the pandemic might have really increased in terms of the delays, they looked at the issue of the halting of security forces training and the cantonment areas and the training centers, and partially even the deployment, and also identify the lack of meetings that the key political actors could have, conducted to ensure that they push forward the formation of the government that did not happen just because of the pandemic. So there are a wide range of things that really come up in that, and basically I can say these are the standout findings that I can stop here and take more.
So you mean you broadly categorize them into those regards to the implementation of the peace agreement, the parties, the monitoring body, the civil society, and all this?
We basically categorize this report according to the parties to the agreement. Then we look at the peace monitoring mechanisms that include, of course, the entities such as the Reconstituted Joint Monitoring and Evaluation Commission, the ceasefire security transitional monitoring mechanism, that citizen, and then we look at the regional guarantors, and then the international partners and the civil society and stakeholders in terms of their roles in the implementation of the agreement before and during, and how things have shifted since the onset of the pandemic. And also maybe something I can say as a very strong finding that came out is the dominance of COVID-19, because when we asked the respondents to basically tell us whether COVID-19 has become a dominant political issue, and a quite big chunk of the respondents, 65%, said yes, the pandemic actually became a dominant political issue that largely some of the parties and political elites exploited to their benefit.
And with regards to the monitoring mechanism, what are the key findings?
Key findings that stand out on the monitoring mechanisms, when we asked the respondents to first tell us before and after whether algenic and citizen were effective in their discharge of duty in terms of monitoring, investigating, and to some extent holding parties accountable for violations. We measured this from very effective to not very effective. And before the pandemic, both algenic and citizen really enjoyed quite significant rating, because, for example, 17.2% said they were very effective, and 29.6% said they were somewhat effective, and 22.9% said they were effective. So if you put this together in terms of average, then it's really quite a huge rating for these bodies. But also when we ask them to basically compare with the pandemic time, whether it's the same in terms of rating and the perception of what academic and citizen functions were in their discharge. And this is where you can see the clear contrast, and we found out that it dropped to 37.8% respondents who said they were, 7.8% said they were not effective, and 15.4% said they were not very effective. So if you put again this together, it's about 50% of the respondents who said both academic and citizen VM were not actually effective since the onset of the pandemic in South Sudan.
And how about on the civil society? And also the political parties.
For the civil society, we asked a different range of questions, and of course we did the same to basically ask them before the pandemic what was the role of civil society to pressure parties to implement the agreement, and a combined proportion of 68.2% of the respondents really believe that the civil society was very effective in pushing for the parties to implement agreement and in ensuring really that they are to some extent accountable for any violations that happen. But that changed so much during the pandemic, because this is where when we ask the role of civil society in terms of advocacy, whether it was affected by the pandemic, and very big proportion of respondents actually recognize that yes, the civil society has not been effective since the pandemic time. For example, 38.8% and 19% of the respondents agreed and strongly agreed. So if you put in total, it's about 50% of the respondents who again say the civil society has not been able to really conduct advocacy activities on the peace process because of the pandemic, and then ask them why. And for example, cited the ban on social gathering, the restrictions in movement, and test policy for you to travel from one location to another. So those are all factors that curtail the work of the civil society.
Well, as someone who did the research, what conclusions have you drawn from there before we ask you on the recommendations?
Basically, I would say that this research points to a true picture of what's going on in South Sudan in terms of the agreement. And one major finding actually that also came out clear when we asked the optimism for peace, significant proportion of the respondents basically show very low optimism for peace. That's about 45%. Again, yeah, 45%. So very low optimism for peace, and that alone speaks a lot about how the population are identifying and owning the agreement itself and its implementation process. So the dynamics that between January 2020 and now, there are quite a lot of things that happen, and we need to be mindful of that. For example, we have the excessive flooding in near half of the country, and we still have the continued confrontation between the signatories and non-signatories of the agreement. We have these defections and the opposition camps split in different political groups. So all this kind of send a negative message to the population, and for them to really think whether this peace process is genuine, is going to remain strong and really deliver the stability that everyone expects. And I can tell you that for now, most of the people are kind of resigned and accepted the situation that it's only time that will tell what will happen. But for now, everyone seems to have given up and basically doing their best in terms of putting food on the table and trying to live their lives without knowing whether that's government or not. And that's really the biggest problem that perhaps the new government needs to really take into consideration, that we need to do something for the citizens to start feeling the peace, to start owning the peace, and for them to know that the peace is here to stay and is to improve their life in terms of socio-economic progress.
Yeah, that I think you also touched on the recommendations, but the report has been clear, and let me ask you one more final question on the recommendations. So you also categorize them, I think, into different parts, into the different categories. So you go on with the recommendations. Yeah.
We categorize the recommendations into different roles of the stakeholders as what they can do differently if they really want to salvage the agreement. Because we know for sure for this agreement to move forward, the primary responsibility rests with the parties to the agreement, and also not forgetting that right now we have the revitalized transitional government national unity. So they have to take the larger share of putting things right. And for this to happen, we need to start building really practical confidence and trust among themselves. And this time should not be just at the national level, but people want to see this trust building move up to the states and counties, because if you take the example of the situation in Upper Nile, it exactly speaks to why it's important for the trust to be built among communities, for trust to be built among local leaders in the state and counties. Otherwise, we can still see resurgence of violence and full disagreements at that level of governance. And also, it's important that the government need to adopt a hybrid approach of managing the COVID-19 pandemic as well as the peace process. And in fact, in our view, in the research, we strongly believe that it's only if the agreement is implemented in letter and spirit that the pandemic will be managed. And the question is how. For example, we have the leadership vacuum in the states and counties. And unless we have strong state and county governments in place, then it's going to be extremely difficult to even stop the spread of the virus. And that's how the implementation of the agreement becomes very important and primary response to the pandemic. And also, it's good that the government and those in charge of managing the pandemic should really exhibit transparent and accountable way of doing things, because we know there's been a lot of money, even if people don't really see it, but it has been quite a significant amount of money invested by the government in the peace process. And until now, some of the key activities that are supposed to be implemented that have not been done. We have seen a lot of money invested in the COVID-19 response, but we still know for sure that the case management and testing and surveillance in South Sudan remains very low. So this is very important to ensure there's transparency and accountability. And among all this, I can also say lastly in the recommendation is the need to ensure that the civic space for the civil society, the media, the church and other actors is really open up, that people can freely engage in peace dissemination, in civic education, in public awareness, whether in the peace process or in the on the pandemic. So that's very important for the agreement and to build confidence in the agreement. And then for the peace monitoring mechanisms, we also recommended that it's important for them to adapt their way of doing things to the COVID realities, to ensure that they strengthen the monitoring and actions on violators, because if that's not done, then only affect the credibility among the population as people who are really able to hold the perpetrators and violators accountable. And they also need to adopt a regional approach, and this now going to the regional bodies like IGAD, the East African Community, and international partners, that it's very important to have a COVID-19 regional approach and political transition, because we are aware that even our region is not that safe. We have seen the election cycle in Uganda, the conflict in Ethiopia, the transition in Sudan. So there are quite a number of regional dynamics and conflicts that must find some convergence and ensure that one does not supersede another in response. And then lastly, is really to start moving towards action and punish those who perpetrate violence and violate the agreement, and ensure that political actors in South Sudan are really held for their actions, because unless that is done, then the situation will still remain the same. And then lastly, to the civil society, is basically for them to step up the advocacy and pressure on peace parties, for them not to really relent on what they've been doing, but to do perhaps more evidence-based advocacy to ensure that parties are kept aware that they have responsibility to implement the agreement. And also for the civil side, they need to really speak with one voice and be consistent, because we know that different formations of civil society in the country, and sometimes because of the divergent approach in advocacy, in raising issues, then it makes the civil society really to lose that degree in terms of influencing political actors. And also for them to be very proactive. They should not wait until there's a problem that has surfaced, then they can start making noise. But they should start thinking about how to prevent, how to reach out and engage actors, so that some of the problems that we have seen can be really contained. And lastly, they should not really stop asking for accountability and transparency in implementation of the agreement and management of COVID-19 response fund.
Well, Malish John Peter, the Institute of Social Policy and Research, thank you very much for your time.
Thank you, Alfred.